All right, Justin. Good to see you. Have you ever seen X-rays of your spine? No. Okay, let's go and show you what's going on here. Okay. So you came in, your low back was hurting. Okay, this is your low back here. That should be straight. What do you see?
It's not straight.
It's not straight. Good thing or a bad thing? That's a bad thing. You remember we talked about the subluxations yesterday where the vertebrae dislocate sideways?
Mm-hmm.
That's exactly what we're seeing here. Vertebrae dislocated and it's pinching the nerves coming out of your back. And what do you think pinched nerves give you?
Pain.
Pain. That's why your back hurts. Okay, but it's not just isolated to your back. If you look here, see how this is also coming up sideways like this?
Mm-hmm.
Again, more of those subluxations in your spine. Okay, chiropractically what we need to do is we need to take these vertebrae and push them more towards the center so they start moving easier. As they start moving easier, guess what happens to the pain?
Goes away.
Goes away. Okay. Secondly, though, it doesn't just hurt, it's also pinching the nerves that are going to your systems. You know, heart, lung, digestion, metabolism, hormones, and immune system, all those things are being affected. And then we're going to go over the scan and show you how that works.
Okay.
One thing I want to talk to you about first, though, is your posture. Do your posture stuff.
Okay.
Okay. You sit at a computer all day. You know, it's a very hard thing. You know, 90% of the patients come in, sit at computers, and this is the posture that you end up with at a computer. Okay. You know, you feel that way all day. That's one of the reasons your back hurts so bad at the end of the day is because with your posture being forward and those dislocated vertebrae, it's going to create pain in the back.
Right.
Okay. When we look at your neck from the side, which is what we're seeing here, see this nice smooth curve coming back this way, this arc? That's what we're supposed to have. This is you. What do you see?
It's not hurt. It's
Yeah.
forward.
It's way forward. Again here. So it's exactly. Can you see that? Okay. What that's doing is it's creating a ton of stress at the base of your neck, coming down into your shoulders and back to your shoulder blades. Remember that tension you were talking about, how your head gets heavy in the day? That's why. So what we really need to do is don't move right there. I want you to stay right there. Here's what I want you to work on. I want you to feel this. Bring this in for me.
Mm-hmm.
Okay. That's what I want you to work on.
Okay.
Think you can do that overnight?
Yeah.
Nah, it's
Oh, no.
It's not going to happen. Okay, but it's something we're going to work on. Okay, the body changes over time. That's really how things go. Okay, so we look at all this, and then we're going to look at your scan. So we see that your structure, you have curves in your spine. Okay, we have a forward head. Okay, let's see how they're affecting you. When we look at the scan, white is normal, green is mild stress, blue is moderate, red is severe, black's off the chart. Okay, so see how there's a ton of red right over the top? That means these nerves in your top of your neck are severely pinched because of the head being forward and this S curve at the top of your neck. Okay, as we adjust these and as we start to improve this, guess what happens to the nerve stress?
Goes down.
Goes down. Exactly. That's how we know we're getting you better. Okay. So if we look over here, basically from about here up, you have pinched nerves.
Okay.
So all of these nerves in here are pinched all the way down. Okay. They go to things like your pituitary gland, which is your body's master chemistry and hormone center. What that does is it regulates and controls all the blood chemistry and all the hormones in your body. Okay, we're looking at your heart, your diaphragm, your eyes, your ears, your sinuses, getting into your tonsils, your thyroid, your metabolism, your immune system. Okay, getting into your esophagus, your upper digestive system. Okay, within these nerves being pinched, how well do you think these systems are going to work? They're not going to work very good. Okay, so basically, without this nerve pressure, you're sick. So not only can we get you healthy, as we're getting you feeling better. Okay, getting people to feel better, getting people out of pain is pretty easy. Chiropractically, a few adjustments, you start to feel better. That's pretty easy. This is the gold. Okay, you talked about how you're tired all the time. And you just feel stressed out. That I was watching yesterday. You just seem like you're depressed. There's not a lot of hope. Okay, when you feel this way, how hopeful can you be?
Right.
You're not. I want to give your life back. One of the things that we're going to talk about, as we're going through treatment, is your work schedule. Say we start fixing stuff, and I sit in your home and you sit on your couch and eat a bucket of chicken, drink a fifth of vodka. You're really getting healthy? No. Same thing. If you go to work and you're working 60 to 70 hours a week, do you think you can really be healthy? No, your body's not meant for that. So we got to look at the other things in your life that are creating stress that are affecting your spine so that we can help you be healthy. Right? Is that something you want?
Yep.
It's something I want to help you with. I'm a firm believer that you have to live. Right? That's what we're here for, is to live. And I want to remove these obstacles that are preventing you from living.
Right.
Sound good?
Yep.
And I'm excited for this. This is going to be a good thing. Okay. Any questions about the X-rays or how they're affecting your nervous system? Okay. So one of the things we're going to do for you is we're going to get you on some traction. Okay. Traction is going to help get this back to there. Okay. Do me a favor, lay on your back for me. Okay. This is a torture block. The traction block. Either one. You can call it whatever you want. Okay. Do about a half sit for me, and then all the way back. Okay, comfortable? Liar. Okay, that shouldn't be comfortable. Okay, let's say we want to sit you up. Okay, what that's doing is we're taking your neck and we're stretching it back like this.
Mm-hmm.
Okay, so here's the analogy. If I asked you to do the splits, what would you tell me?
Can't.
No way. Okay, if you at home you stretched every single night, eventually,
Okay.
good. Same concept. If we stretch you like this on a regular basis and get this stretched back, what eventually is it going to look like?
Yeah.
Exactly. Okay, in addition to that, I want to talk to you about your workstation, about where your computer's at. I'm going to give you some tips to help it work so that you help you get up and stand up more, so we can help not just fix your spine here, but correct what's causing the problems. Does that make sense?
Yep.
Okay, so with the traction, I'm going to give you some instructions. Basically, you start off with a minute tonight, 2 minutes tomorrow night, 3 minutes the next night. Work yourself up to about 12 to 15 minutes a night, 5 to 7 nights a week. Okay, what that's going to do is kind of retrain those muscles and really help shift this back to there. Does that make sense?
Yep.
Cool. Any questions?
Do you don't use it anymore? Or
I
is there
do.
a cervical problem?
I do. It's more of a, if they're dramatically reversed, mostly women, Dowager's hump. I'll get into that.
Okay.
It's just one of those,
Okay.
or
And then.
let's talk about treatment. Okay? Right now you're here. Agreed?
Okay. Yep.
Okay? Okay, there's 2 stages that we want to address in chiropractic care. Okay, the first stage is what we call stabilizing care. It's going to get you right here. It's about getting you feeling better and getting your symptoms gone. Brings us up to this level. Okay, now in our office, stabilizing care is 3 times a week until you're stable. Okay, so you're looking at about 8 weeks. Okay, imagine if you went to the gym 3 times a week for 8 weeks. What would you expect?
A change.
Okay, why?
Training muscles.
Yeah, and then repetition. If you want to build a big bicep, can you do 1 curl?
No. You
No.
do.
You gotta do a bunch of them. Same concept. If we need to change the structure of your spine and help those vertebrae start moving, it's going to take a repetition. Does that make sense?
Mm-hmm.
That's where this comes in. With enough repetition, we get those vertebrae moving, the swelling around the spine begins to come down, and pain signals are shut off. Okay. Once you get to this point, some of our patients will stop coming until they hurt, then come in and get a couple adjustments and stop coming until they hurt, then come in and get a couple adjustments and stop coming until they hurt. Okay, but if you notice, they're actually still getting worse. They're never really getting, they're managing their pain, but they're never really getting healthy.
Mm-hmm.
Or they'll come in like once a month, which we call maintenance care. They're not really getting better, they're not really getting worse, they're just maintaining their pain level. But they're not really dealing with this. Okay, this is what we call wellness care. Wellness care helps us with this. It's more preventative. We're changing the structure of your spine for the long term. It's the traction. It's really fine-tuning your spine to where we can shut off the pinched nerves so that your body's actually will be able to work the way it's supposed to. Restore the function of your immune system. The best example I give you in wellness care is my family over there. I have 4 kids. My kids are 8, 6, 4, and 2. Okay, in the last 6 years, we've been to the doctor twice. Wow, which is kind of unheard of nowadays. When my children have such a healthy nervous system that when they get a virus or bacteria, their body's able to deal with it right away and it doesn't become really symptomatic. Okay, that's the gold. We were talking before. This is where life comes from. So I'm expecting to get you out of pain relatively quick. We feel better. If we were to stop there, the pain would come back. Okay, but if we're able to continue, you can actually be healthy.
Awesome.
Now, I know finances are a big part of the decision, so what I'm going to do is I'm going to have the girls come out and go over finances. What your out-of-pocket is, how much your insurance is going to contribute. They'll go over scheduling, and they'll basically help you, give you some options for your care. After that, I'm going to come back in and get you adjusted. Sound good? Perfect. Cool. So, yeah, generally I do the whole, like this morning, weighting of the head, blah, blah, blah. We talked about that.
Where'd you get that?
My buddy sent it to me. Yeah. So, I mean, it's easier for me because it's my setting, my office.
Mm-hmm.
Again, I think the biggest thing that you can do is take what's important to them right now, which in this case it was the dude's not happy, his back always hurts. Okay, take that and motivate him. You can help him. Give him that, and then